Orgasms is something we women in India particularly don't talk about. What you might find surprising is even if I ask women, from like our own friends, many of them will say I've never orgasmed. And I think that is something that needs to be addressed. So, orgasms are vaginal orgasms, clitoral orgasms. And today we give injections like shots. That's why they're not shots, of course. But we inject them with PRP or with exosomes today. We can inject them in the vaginal area, which gives you orgasms or vaginal orgasms. We inject fillers there, which is hyaluronic acid.
So these shots work for how long?
They roughly work for about 6 months to a year.
Okay.
Yeah, and then most of our patients come back after 1.5 years. And also, as we age, the sensitivity of the clitoris goes down. So many menopausal women will come and tell me, I find it very hard to orgasm. If earlier I used to do it in 10 minutes, now it takes me half an hour. So this sensitivity can be improved by these simple techniques. So they simply love it. So what you might find unbelievable, for the 3 years we spent there were nearly 25 to 30 deliveries every day. We were a unit who had emergencies on Mondays. So occasionally we used to have a Sunday Monday because every unit gets Sunday by turn. There was a time once when I've entered the operation theatre on a Sunday afternoon, gotten out on a Monday afternoon, non-stop deliveries, and the amount of work I think was phenomenal. So I think so many things we can do in our sleep now.
Hi, welcome to our 4th episode of Consultants on Couch. Thank you once again for supporting us for a 3rd episode with Dr. Bhargav. If you like this one's going to be better than the 3rd one because we've got a very dynamic gynecologist professor. She doesn't look one bit like a professor.
Thank you.
And if you like this episode, please give us a feedback. I would like to introduce Dr. Sejal Ajmera, or Professor Sejal Ajmera. She's a gynecologist of great repute, academically brilliant, been a gold medalist. She's from Sion Hospital, president of IAVA, almost sounds like IFA, but it's probably more important than IVA.
Right.
That is a vaginal aesthetic, and she's one of the pioneers in vaginal aesthetic surgery. She's done a lot of social work, one of the pioneers for the menses education, the PAD Bank Initiative.
Yes.
She's very creative. She was responsible for the 3 Idiots delivery scene, which is sort of iconic scene.
Thank you.
Welcome, Sejal, and it's nice to have you.
Well, I can't believe I'm saying this, but I'm happy on the couch. So
That's brilliant. No, that's tempting. So, Sejal, so most of the questions that I ask consultants, they start off academically, then we get onto your personal thing. Academically, you've achieved such a lot, and when I read your CV, I was humbled.
Thank you.
So you've been a gold medalist,
yes.
and you've been a president of an organization, you've done your fellowships abroad.
Yes.
What was it in Sion? I mean, how was your journey from MBBS to what you're doing right now?
I'm so glad you mentioned this because this is something I like to talk about like maximum.
Brilliant.
I think Sion Hospital was quite an eye-opener. I was an undergraduate student from there, and I decided to take postgraduate gynac in Sion as a choice. Now, the day I joined MBBS, I had only one aim, that if I become a doctor, I'm going to become a gynac. So I think that was very clear.
What inspired you to just gynac? I mean,
my mama in Ahmedabad was a gynae. And I saw his and his wife's life in a nursing home in gynecology in Ahmedabad every Diwali vacation or summer holidays that we spent at my mom's place. That was very inspiring, and I was very, very fascinated by this entire birthing process and how a little embryo can become this baby and come out.
It's a miracle. It's God's miracle, I think.
Yeah. Also, I think this deeper attachment to women and wanting to help and being a really good, maybe a cure person or somebody who people can just open up to was always behind my mind.
Mama was your inspiration?
I think so.
Okay.
But I must tell him that I've never said this to him. Yes.
So, in your times, so in my times, we just had to Wien MBBS, then progressed to Gyna. Did you have to give an entrance exam for
No,
gynae?
we didn't. We
Okay.
didn't. So I'm from the same time, relatively, right?
Easier.
Yes, so much easier. Then we were the last batch to escape the entrance examinations. So we directly, managed to
into
get a
that. Oh,
distinction
that's
and
brilliant.
then got into gynae.
So you got your distinction in gynecology in
MBBS.
Oh wow.
That's right. That's right.
And then gold medalist in.
Yes, but I must tell you very interesting facts that when I finished MBBS and I got a distinction and they called us in that where do you want to do your MD gynae? And I said Sion Hospital and they was like no, you're getting Vadia and KEM. I said I know, I want Sion by choice.
Wow.
So I was very lucky because I got my mentor Dr. Vivek Patkar by choice. I worked under him for 3 years and that was the most brilliant 3 years I think I've ever spent.
I mean, just for the viewers to know, so on an average, I mean, people don't really know the concept of municipal hospital deliveries.
Yes, yes.
It's like a conveyor belt.
Yes.
I remember my internship, we went to Vadia
Yeah.
and we had to do this logbook of how many deliveries.
Right.
And we could just finish a logbook in one evening, one night.
Yes.
No, 15 deliveries. So how many deliveries would sort of happen in Sion on average?
So what you might find unbelievable, for the 3 years we spent there were nearly 25 to 30 deliveries every day. We were a unit who had emergencies on Mondays. So occasionally we used to have a Sunday Monday because every unit gets Sunday by turn. There was a time once when I've entered the operation theatre on a Sunday afternoon,
come
gotten
48
out on a
hours.
Monday
Yeah,
afternoon,
absolutely.
non-stop deliveries, and the amount of work I think was phenomenal. So I think so many things we can do in our sleep now.
But I will be honest with you. So the delivery that happens in a municipal hospital,
Yes.
and there's a sea of change delivery in the kind of people you do right now.
Yes, there's an absolute change.
What's sort of, obviously birthing is the same.
Yes.
But nowadays, because delivery has become a big thing,
It has.
people really select where they're going, and there are
Right.
hospitals like you are attached to Surya Hospital,
Yes.
which is
Yes.
specializes in OBS and stuff.
Yes.
And
Yes.
how has it changed? Let's talk about OBS right now.
Okay.
How has OBS changed over the years?
So I think OBS has changed phenomenally well. Like you said, the process of delivery really doesn't change. When I look at it from the patient viewpoint, I think the women who came to Sion Hospital were usually of a lower socioeconomic class. What I loved about them is they had the resilience and they
were
had
tough.
the power. They were
they're
tough.
They're tough.
And they used to come and they used to deliver so quickly. They could
Exactly.
take pain so well and
amazing.
smile through the labor process. Right, so that was amazing. Saying that, I think today that is a bit changed. You see more and more women who are a little afraid. I also
Scared.
think the media is really responsible. If you look at anything like episodes of Friends or any movie, they make delivery such a big deal and everything is going chaotic and wrong. So I think a lot of fear is instilled in women for labor.
Women are designed to deliver, aren't they? I mean, God's made them.
They are. They are.
So one interesting thing I'll tell you. So when we started here, this is about now 20 years.
Yes.
And Cherry, she's a very senior guy.
Yes.
Used to do a lot of delivery. Now we don't do too many.
Right.
We had this one lady who delivered in a lift.
Yes.
And she just walked in,
Right.
did a lift, and in 5-6 hours she went home.
Yes.
It's
Yes.
like so quick.
Those were such phenomenal days, and I miss those days now. Because when patients come to us saying that they are in a lot of pain, they are barely 1 or 2 centimeters dilated and they have nearly half a day to go. So those kind of thing I miss. But there's one more thing about it which I love now, that the couple,
They're
both the
more involved.
partners are so involved.
And
They
that's
want to know everything. From the time they are pregnant, they want to know how can we make our antenatal period better, not only for the mother, optimal growth of the baby. So I think that is phenomenal. We actually have recorded talks for all the trimesters which we share with our patients, so they understand the process physiologically, the do's, the don'ts, how to
Absolutely.
optimize
The
stuff.
males are now getting more involved with the women delivery.
Oh,
and
they
stuff.
are, and so it's really beautiful.
Yeah, it's very nice,
Yes.
because I've got 2 children.
Yes.
And regretfully, I was in England and I was, working and hard and stuff, and we
Yeah.
were alone.
Yeah.
Didn't get too much of chance to really become the father.
Right.
So nowadays you
Right.
see males trying to put a pillow, walk
Yes.
about, and but it's also to do with the social media, you think?
I think so, but I must share this story with you. I had a couple who came to me who were pregnant and they were contemplating, in the early trimesters what to do. And I said, why are you guys, thinking about it? You seemed quite ready for it. And they said, okay, doctor, please share with us, how do we bring up our son or daughter in a gender neutral environment with no specific roles designed to either parent? So can you imagine, from the time they were pregnant, they were thinking about how to have a neutral environment at home. I thought that was beautiful.
No? I mean,
Such awareness.
Brilliant.
Yeah.
So from Sign, you progressed on to private practice, or you did any sort of postgraduate or further super specialization?
So I went on to private practice at that point in time, but I did a lot of subspecialties or super specialties outside at that point in time. The most interesting was the fellowship in minimally invasive surgery, so laparoscopic surgery. So first I went to Singapore to get trained. Then I trained in Mumbai under Dr. Neeta Varti for some time. Then I went to Kiel and Clermont-Ferrand in France and Germany. Got my diploma from there, came back, started doing a lot of endoscopic
France,
work.
you went to Strasbourg? Or
I went to Clermont-Ferrand. It's a little smaller town, but it has amazing laparoscopic work. So that was beautiful. Then I did...
So now laparoscopy is still a major part of your practice?
It is. Per se, I think surgeries have become less because as I look at this entire field of gynecology, we are evolving from invasive procedures to minimally invasive procedures to now non-invasive procedures. Things which we used to operate for at the drop of a coin, we are not operating for now. We have so many medical treatments available.
Also, I think we are doing a lot of preventive gynec. You're picking these cysts and treating them earlier and stuff. So your patient population of women starts from teenagers to the entire gamut, with old menopause ladies, elderly urinary problems. So what, if you tell the viewers what sort of an average divide of these patients? How much is OBS? How much is gynecology? How much is the topic that everybody is going to be interested in, vaginal aesthetics?
So I think over the years things have shifted, and you're right, we are treating actually even babies, because a lot of even newborn girls who have some bleeding or something come to us. The oldest patient whom I've treated for aesthetic gynecology is 93 years old. So we have the whole gamut of range of patients. Of course, maximum people probably coming to us in the 30 to the 55, 60. That's the range for aesthetic and functional gynecology. Unfortunately, OBS is now becoming less and less. I love obstetrics. I think it gives me my fire.
What motivated you?
Yes, it did. It did. So, but it's become less. I think gynecology is now becoming more and more common. But, when I started this aesthetic gynecology training for doctors, and we used to teach them for 3 days and 4 days, and we used to tell them, you're gynecologists, this training is enough. Some of the doctors came up to me and said, but we want to train with you for 6 months and 1 year. And in my mind, I'm like, I don't think I do enough work to really train you that much. What I'm very happy to share is now we have 2 one-year fellows, and when I saw their logbook, we are doing nearly 1 procedure of aesthetic and functional gynecology every day, which means nearly, I think 70% of my practice could be related to the newer fields.
So, it is a very new field for me, though I've been in practice for a very long time. When you first came up with this aesthetic and stuff.
That's right.
The Indian Association of Vaginal Aesthetics, it is now what, 15 years old, 9 years old?
It is 9 years old actually. We established it in 2015, and the idea was just to train doctors for these newer concepts. And a lot of times I feel that COVID has really shown that now, but quality of life is important. I saw that particularly in our country, a lot of women who are older, I think, particularly post-menopausal life, they are told to live with so many things which they absolutely shouldn't be living with. And that was the idea, that make doctors aware of whatever we can change for them.
And this very similar conversations having with Ranjit, he's a plastic surgeon.
Yes, I know him.
And now we are realizing that, age is not a barrier to stop living or, to aspire what you want to do.
Not at all.
We find entrepreneurs at the age of 70. We find trekkers now going to Mount Everest at the age of 65. So world is changing.
So in that
tell me your journey with aesthetics. Tell me how did you sort of OBS and now trying to beautify
Right.
Or I'm not, so I personally don't know what aesthetic means, and I'm
Right.
sure a lot of even medical professionals. So what kind
They
of,
don't
what is
know.
vaginal aesthetics? I've read up a little bit.
Yes.
And
Thank you.
so you deal right from congenital vaginal abnormalities
Yes.
to old age, incontinence and stuff. Just tell me, what is the
Yes.
total subset of patients that come to you for aesthetic surgery?
Okay, so beginning with the first question, that how did I get into it? I think from 2008 and 9, I was at a place where a lot of plastic surgery work was happening. And then the patients came up to me and said, "Doctor, please do a labiaplasty for me."
Oh.
In my head, I was like, I don't even know what a labiaplasty is. And then they were like, "It's so easy, we have excess large labia, just cut them." And I was like, well, okay. Fair enough, and I tried my best at achieving good results. But in reality, I think I did a lousy job. That is when I realized that no, I've got to be
need to be
trained
trained
for
for
this.
this.
And then I found a fellowship in USA under Professor Red Allensod in 2012. I went to him and I learned all the surgical aspects, which were vaginal tightening, which is more of functional rather than aesthetic. And that's why this field, we are trying to call it functional and aesthetic gynecology. So we learned all the surgeries like vaginal tightening, labiaplasty, clitoral hood. Many women have a clitoral hood which looks like a man and they are not happy with their appearance. That started
So
happening.
reduction of the clitoral.
Exactly. So it all began with surgeries. When I got back, the idea was to just operate. But 2013, laser devices started coming into gynecology, and we were unaware. The dermats are so good with lasers.
Absolutely.
We were really quite a novice, and they said, "Doctor, try the lasers. They
I
work."
use a lot of laser now with piles, fistulas,
Right.
parietal sinuses
Right.
and stuff.
Right, right. So when they came in, I said, "What does it do, a laser in the vagina?" And they said it can cause tightening and it can decrease urinary leakage problems. And I said, well, okay, there seems to be no flip side to it. And I started trying that. And in 2013, we did the first Indian study of 40-50 women for urinary leakage with lasers. The beauty of these lasers or energy-based devices is it's totally non-surgical, walk in, walk out. 3 sittings are
This
usually
is
required.
Incontinence, where
Yes.
you used to do big surgery, those tapings, and that used to happen.
So can you imagine coming from a very difficult surgery to a phase in life
Walk
where
in,
we
walk
tell
out.
patients walk in, walk out. The procedure is totally painless, no anesthesia, no downtime, and the results are fairly good, nearly 80 to 90%. And this is not only for women who leak, but there are women, if you tell, say, maybe your wife or your mom that let's go from here to town, they might tell you, no, I don't want to go because on the way I need to stop by for a loo break. So holding capacity, leakage, the fact that you're looking for a loo every time, waking up more than once at night. So these entire gamut of urinary symptoms now we control with such simple walk-in, walk-out
Even with
procedures.
this Swachh Bharat and toilet Andolan, actually it is not, on ground, it's very difficult when you're traveling on the road.
Exactly,
And
exactly.
so these sort of things, you get a lot of patients who want that control of urine.
Yes, me myself, if I had to drive from here to Pune, I would be hesitant because I would have to take a break in between, and now I don't, so that's fantastic.
So what other sort of vaginal aesthetics? So one is clitoral reduction, vaginal plasty, tightening.
Yes.
What else sort of falls into vaginal aesthetics?
So there are 2 things, okay? Like one we say is the aesthetic part and second is the functional part.
Okay.
Now when we talk about the aesthetic part, today what is becoming very popular apart from vaginal tightening, which has been asked for generations together, is labia majora aesthetics. So that is quite interesting as we age, like our face, collagen falls, the sagging happens, the fat volumes go down. Similar things happen in the vulva, especially for patients who've had massive weight loss, bariatric surgeries. The vulva kind of multiple pregnancies, the vulva falls and starts sagging. And today women want a youthful appearance, they want the wrinkles to go down. So we are doing a lot of labia majora aesthetics for women of an older age group. Something not spoken about very often is GSM. It's called genitourinary syndrome of menopause. So these women have a lot of itching and skin issues on the vulva.
Exactly. Very
People
common.
keep feeling that this is because of some fungal infection, and they are taking antifungals,
and
right?
stuff, yeah.
Right. So today we are pushing hyaluronic acid on their vulva, and they are doing beautifully well just without any antifungals. We are using a lot of PRP and exosomes. In fact, at our IVA World Congress last week, we launched the world's first autologous exosome machine, where we can inject these exosomes into the patient.
So for the viewers, tell us what is exosome. I know hyaluronic acid, I know PRP, everybody,
Yes.
I think PRP and all those things have become common.
Yes, yes.
So what are exosomes?
So exosomes are like the bark of PRP. They are made from 1 billion particles compared to PRP, which is made from your blood. Now, exosomes can be of various types. One is what we find it acquired, and you can keep them in your room with the powdered form. But DNA is got from outside. So very common are plant-based exosomes, which people feel don't really work, or they can be salmon-based and amniotic fluid based. So they are available as vials. We just reconstitute them, and you can use anyone's for anyone's, which is the beauty. There's no FDA approval regarding injection of exosomes,
It's an external application.
Yes, because they are DNA derived, right? But we are now making autologous exosomes in our own clinic, which means we make PRP from the patient's own blood.
And make their
we
own
make their own exosomes. So these we can inject because they are autologous. So this is something we are doing.
How do they work?
So they cause hydration, they cause neovascularization, they cause better epithelium where they are. So we are using it for even say, like energy-based devices for incontinence, overactive bladders, we inject them. There's something very popular on the face you might have heard of called vampire facial, right? We do the same thing for the vulva. They work beautifully well. There is one very debilitating disorder in older women called lichen sclerosis, where there are white patches and they are constantly on steroids, and the steroids will stop working. So we are using injectable exosomes for these women, just 2 sittings, and they stop itching for a year and a half. So it's really changing the scenario.
Are these becoming now price sensitive? I mean, what's the cost? Are they expensive? Are they sort of, do you get, are the prices coming down? Obviously they will
come down. They will come down. Well, let me tell you, like for example, there's a Korean exosome I have, which is amniotic fluid derived, and one vial, which is like 5 ml I can make out of it, is 80,000 Indian rupees. But the moment there's competition, prices come down. So the autologous exosomes we make at our clinic, now we are charging 50,000 rupees. So I think with time, hopefully, things will start coming down.
That's a good reduction from 80 to 50 in autologous, not even...
Yes.
Great.
Yes, totally.
So, what sort of do the males come in and say, oh, they want some aesthetic vaginal surgery for their wife? How does this work?
Right. Yeah. So, of course, there are sometimes both the partners who come down, men or women, who say, I desire this for my partner. It's one thing we strongly discourage, because we feel that the patient herself should be motivated enough to want something, and we always tell them that never do it for a partner or never do it for something like that.
Do it for
but
yourself.
If you yourself are keen on doing it, we are more than happy.
Self-confidence, gives them that push and stuff.
Yes, absolutely. But males do come down to our clinic because we have this very fascinating electromagnetic stimulation chair.
RF,
we have a chair. So this is electromagnetic stimulation. We have 2 chairs. One is European Union approved, one is US FDA approved. They are called Tesla and Amcella, and they work for erectile dysfunction, for male incontinence. So people who have, men who have post-prostatectomy, urinary incontinence, cancer bladder surgeries, urinary incontinence.
Isn't it?
They sit on it fully clothed, and they go back. So it's beautiful. For the 28 minutes that they sit on it, it does 11,200 pelvic floor exercises.
Yes, what are they called? Was that popular word for that?
Yeah, Kegel's throne.
Okay.
So we have this since 2019.
Wow.
So more and more men walking into the clinic now too. Like I said, it helps for erectile dysfunction. So even like we give these orgasm shots for women orgasming,
heard of those
we
things.
give Priapus shots for men.
O shots, G shots,
That's
now
right.
Priapic shots.
P shot.
P shot.
Yes.
So P shot is basically you inject them with
PRP.
PRP.
Yes.
Okay.
Yes.
And if you will just tell the audience about O shots, G shots, and so what exactly are these?
So I'm very happy to talk about this because orgasms is something we women in India particularly don't talk about. What you might find surprising is even if I ask women, from like our own friends, many of them will say I've never orgasmed, and I think that is something that needs to be addressed. So orgasms are vaginal orgasms, clitoral orgasms, and today we give injections like shots. That's why they're not shots, of course, but we inject them with PRP or with exosomes today. We can inject them in the vaginal area, which gives you G orgasms or vaginal orgasms. We inject fillers there, which is hyaluronic acid.
So these shots work for how long?
They roughly work for about 6 months to a year.
Okay.
Yeah, and then most of our patients come back after 1.5 years.
And you see a big change in their sort of feeling.
They are very happy.
Yeah, I'm sure it must be
very happy.
Very new thing if they haven't had it before and stuff.
Yes,
okay.
And also, as we age, the sensitivity of the clitoris goes down. So many menopausal women will come and tell me, I find it very hard to orgasm. If earlier I used to do it in 10 minutes, now it takes me half an hour. So this sensitivity can be improved by these simple techniques. So they simply love it.
So from vaginal aesthetic surgery, and I can see that right from your earlier days you sort of focused on women empowerment, getting their life better, deliveries better, now their sexual life better and their confidence better and stuff.
Right.
I believe you worked with the menstrual education.
Yes, I do. Yeah. I do it for schools and colleges. And we have these adolescent health talks. So there are different talks for different age groups, and we start at the, when the girls are in the 6th and 7th standard, and we walk them through the different aspects of menstrual hygiene. The ones we do for 17 and 18-year-old, of course, we are talking to them so much more about, the different types of touch or about, contraception. Primarily about sexually transmitted infections. Absolutely. And the most important thing today is the HPV vaccination.
Yes.
So we cover this entire gamut for many, many girls.
And you were involved with the pad banking?
The first pad bank initiative, yes. Actually, it was a great idea to have because girls don't have access to healthy menstrual products. A lot of them were...
Which was Akshay Kumar's movie based
that
on
came later.
Yes. I mean, it was something, it was an eye-opener. And
it was.
I think what a subsection of society really doesn't understand that these are genuine problems.
Yes.
When you go down the line and you see, villages, places.
Totally, because they were using cloth. They were not really cleaning them well, and it led to so many infections. So to have affordable pad banks or banks where pads were totally free for so many girls really helped.
Donates, so the government's providing?
Yeah, this is donation. This is by an NGO, so they collect donations.
Activities and stuff happen.
Yes, and they happen. But now government is of course taking this into cognizance. So hopefully we'll have governments doing that.
Support for this.
Yeah, we also did something very interesting for the Bihar government. Okay. So we actually made this hamper kits for girls and boys, talking to them about menstrual hygiene, sexual practices, safe sexual practices, protecting them against STIs. What I loved is, this is Bihar government. We made these hampers in 2015. And they spoke about same-sex relationships. Even at that point in time, we had booklets. And then they could scan it, and they had videos with me talking to them. So it was very exciting, the work we did.
Interesting. I mean, this is all new to me when you're talking about this.
Yes.
So, coming back onto sort of, these women's sexual education and stuff, do you think that there is more promiscuity in general society right now? Or there is more awareness about sexuality and more teaching that is happening in schools, colleges and stuff? What is your general feeling? Is it a good, bad? What do you feel about?
I think it's amazing. I think it's very progressive.
Yes.
I think it's very progressive. We have parents who get their daughters to me in the clinic, and they know that their children are sexually active, and they say, okay, you talk to her, I'm sitting out because she will not talk in front of me. They are like, doc, talk to her about contraception, about getting pregnant, about choosing the right doctor in case you do end up, with a pregnancy or with sexually transmitted infections. I think women are out there, women masturbation was such a taboo topic. I have an 18-year-old who came to my clinic 2 years back and said, Doc, can you look at my clit? I think there's something wrong. Now, for me to understand clitoris was, post MD days, probably. So I love this change that is happening. Do you call it more promiscuity? Well, I think not. I think today's youth are more open to say that, okay, we can have casual relationships
So
and
it's more
fine.
out in the open rather than it
Absolutely.
was always there probably.
It's always there.
Yeah, and now people are getting more, and I think it's safer.
I think it's so much safer.
Safer and
yeah, yeah.
So the work that you're doing right now, mainly aesthetic and stuff, does that sort of, you get male sort of influence in that? Do they sort of come and get? Do you think there's a scope for a male sexual improvement, like plastic surgery, that I can take up? Because this sounds-
Yes, absolutely.
And I know plastic surgeons who are doing penile enlargements, prosthesis and stuff. So that's great.
I think it's coming up. I think for men, most of them who come, I think rather than the aesthetic part of it, again, they are more into functional. Like even for what I treat, I think 90% of what I do is functional, only 10% of what I do is aesthetic. So for the men, it's erections and urinary incontinence.
I think that area does deal with a lot of excretory functions, which are very embarrassing for a lot of people and stuff. Gender identity is big in US at least.
It is here.
You know, and people are being called it till they decide.
Yes.
In schools and colleges. Yes. Do you find a lot of gender identity patients or things like that? I mean,
I do. Okay. I do. I think it's the field I'm in. A lot of them, come up. What I love is a lot of young kids or not so young kids, many women coming to us and then talking to us very openly about how they identify themselves. Okay. It's a very hard time for the person who feels they are misfit into the gender, given to them by their parents or by their genes, and they are really struggling. So I have many, say, boys who say, I don't identify myself as a boy at all and I want to transition into female, but they need to think it through. It's such a long process of hormones, surgeries. It's a very tough one.
In Sujay, we've had 2 sex change operations.
Yes.
And it was male to female.
Yes.
And I can relate to what you're doing because I was standing by there.
Yes.
Because some plastic surgeon was doing it.
Yes.
And the way they created the vagina.
Yes.
And once they created the vagina, I can understand, a female now, a male who's now got a vagina and be in life always wanting a thing and that aesthetic value. So you probably, the vaginoplasties would come in sex change operations also?
They do. Okay. In fact, a lot of times we encourage the parents to be supportive. They feel that's a disorder that needs to be treated, and if they are given some kind of therapy, it will go away. But I think the parents need to definitely be more understanding and inclusive, because we are seeing a lot of higher suicide rates for these kids who feel that they are not fitting. But I must tell you an interesting story that I had.
Okay.
I inject botulinum toxin for a disorder called vaginismus, where the patient is unable to be sexually active because it's extremely painful. So I had this patient from Dubai who was constantly in touch with me saying, Doc, I want to come to you for this botulinum toxin treatment. My vagina is very tight. That happens quite often. And I said, sure, when you come down to Bombay, I'll see you. She came in one day, examined her. She said, my menses were normal, everything good. But I've had a bad fall in childhood, and the person who stitched me up on the perineum did a very poor job. I thought it must be genital mutilation. So I asked her about it, and she said, no, nothing like that. It's just a bad fall. Doc, see me. When I'm examining her vagina, the vagina is not looking like a vagina at all. My staff is like, Doc, you're in the rectum. This is not the vagina. And I said, 20 years of practice, and that's what you're telling me.
God, so I was traumatized the whole thing.
I was in the vagina. I looked at it and I couldn't find it.
So rectovaginal fistula?
No. So then I asked her and I said, listen, are you a person who's had a sex change? Because if I was to inject botulinum toxin for you, it's not going to work. She started screaming in my OPD, what kind of a doctor are you? You are humiliating me. How dare you call me that, I'm a trans? And I said, I'm not calling you, I'm asking you. And she's beautiful, olive skin, green eyes, really amazing lady. And she was like, I have come to you for this treatment and I'm going to take this and go. And she's really creating a ruckus outside. She made me talk to a doctor who said, I'm her family physician. Doctor, you're very offensive. And then I realized this was all a farce because you don't have family physicians in Dubai.
Yes, absolutely.
Then I found out from a surgeon who had done a nose job because she had a little bandage here that she was actually a trans. And then I was also very smart, and I
She
said,
was into
fair
a
enough.
denial. I think this gender identity and they borderline on sort of gynec, plastic surgery, but a lot of psychiatric
They do. Yes, yes,
stuff. I mean,
yes.
they've been through a lot, and
They have. So she found it so hard. But to tell you, then we did inject botulinum toxin, and it did work.
wow.
Yeah, just the area was different. But yes, today we are seeing this more and more.
Oh, wow. So, what do you now see as sort of, you know, now there is another option for young gynecologists to
Yes.
not do obs, not to do
Yes.
gynac, and can they just straight away get into this? Or you think that it's very mandatory that you go through the rigors of delivering patients in the night, looking after patients, or it's just you probably now we find that super specialists, you know?
Yes, yes.
Like diabetologists
Right.
who just come and they are diabetologists. They don't treat
They don't
anything
do
else.
endocrino. Yes, yes.
So what do you feel? Is that a way for young gynae? Would you advise that? Do you think there is a way that they can do that?
So I think you've hit the nail on the head because we have a lot of youth. Every day they call me saying, Doc, I don't want this lifestyle which my mother had or which my
Yeah.
father had of staying up all night and delivering patients, etc. Of course, I do think a gynac training is mandatory. So whether you do 3 years of MD or 2 years of DGO, that is definitely mandatory. So go through the grind initially. But then if you want to choose a particular lifestyle, I think that's very important today. Like work-life balance is one of the important things that I learned through my journey. And I love it that the kids are very conscious now when they say, I don't want to work all the time and I want this as a subspecialty. And from the doctors we've created in this aesthetic and gynae
the
world,
teaching stuff.
so many of them are doing stand-alone aesthetic gynecology, and you'll be shocked where all. Places like Hyderabad, Varanasi, Raipur, Nagpur, they have stand-alone aesthetic and functional gynae clinics. That's it.
This is the growing India
Yes, it is.
that is happening, and you would find, it's initially it would be sort of the distinction would be like South Bombay people would do more aesthetic. I mean, statistically, you would
Correct.
see, the South Bombay people more into aesthetic surgery. I'm talking about decades ago.
Yes.
Not now
Yes.
necessarily. But now it's like Bombay, Hyderabad, Nagpur,
Yes.
and
It's
aesthetic, the
the
awareness.
routine people, right?
Yeah, I
like
mean-
any plastic surgeon will tell you that it's always a routine person. Of course celebs do it, but it's everybody who does it.
Everybody wants.
Yes.
So, I must at this moment tell you what happens with medicine and more so with pharmacy.
Yes.
Okay. So most of the drug inventions that happened, you invented a molecule, found out that this works in, say, for sedatives, for
Right.
that matter. They found gives you sleep. Then the demand is created. So you're not catering to a demand, but once that thing is available, then the demand just happens. Do you
Right.
think that happens? Is going to happen with aesthetic surgery, with this? That you are also creating a demand, not only catering to a demand. Do you think that will happen?
No.
Okay.
And the reason I don't think that is I think that women have suffered a lot, whether it's incontinence, whether it's sexual dysfunction, whether it's just poor self-esteem. Like one of the ladies who came to me said that my husband, she was from a absolutely low socioeconomic status, and she said my husband refuses to have sex with me because my clitoris is large, and he says I will divorce you and marry somebody else. So a lot of times we feel that we are creating the demand, but a lot of times I feel that actually
an inherent
there
problem
is an inherent problem and
that
we
we
are
are
not
solving.
addressing it. In fact, a lot of our initial conferences were called her unspoken problems because nobody talks about this. I always put my one favorite slide on every talk I do, that this is a doorknob moment, which means a patient will come into my office, talk to me that I have vaginal discharge, I have this and that. When she's at the door, she'll tell me, Doc, I have urinary incontinence or fecal incontinence. They never talk about it.
Never talk about it.
But we need to be so comfortable with our patients that they come up front and tell us, look, I have this problem, can you sort it? So I feel that there is a huge lacuna there.
So the same thing happens. So nobody in a circle, if you're in a social circle,
Yes.
and people talk, oh, mera bypass. The short words for big surgeons where they use, I have got
Right.
it done with Asian art, Bhattacharya,
Yeah.
heart surgery ho gaya.
Right.
If you tell them piles hai kya, they will not discuss it,
True.
because these are sort of very
True.
closeted diseases.
Correct.
And so you are serving and you are treating a problem for that matter.
We have only one luck. As regards some men who may have piles and not talk, women talk. So at least they tell their friends.
But generally, I mean,
Yes.
generally, patients
I
don't sort of
agree.
go and explain these sort of problems, and
I
this
agree.
is also a closeted problem.
It is.
But I think wonderful. I think most people, I wasn't aware. Now knowing
you.
about these sort of issues that
Yes.
women have.
I must just talk about one particular thing. We recently published a paper. We've published 6 in aesthetic and functional gynae now, which we did with Tata Hospital and the ICMR research.
Okay.
And we spoke about how patients who are rectal cancer survivors
Absolutely.
need to improve their quality of life.
Radiation, chemotherapy, and I think
Yes.
post-cancer treatment.
Yes. So we are
Sexual,
catering
yeah.
a lot to that segment of cancer survivors also, which is very heartening.
Oh, that's great. Now looking at your work-life balance, which you mentioned briefly,
Yes.
and I think with all the consultants I've spoken to about work-life balance, I personally feel is a luxury now. At what level of practice you attain. I think when I started practice, came back from England, young,
Yeah.
kid, growing family.
Yeah.
There was no concept of, I couldn't do work-life balance. So do you think work-life balance is a necessity or it's a luxury of young gynecologists or doctors for that matter?
Okay, so let me tell you. For
I'm
me,
sure, not just doctor, let's talk about
Any
IT
specialty, yes.
people, everybody, young business people who are like
Right.
trying to get their status.
Right, right. So I joined private practice in 2000.
Oh.
It's 25 years of private practice now, nearly. And it was 2000 Jan, yeah, so 25
Okay.
years. When I joined, initially I used to work like any gynecologist does, start at 9 a.m., finish at 2, go have lunch, come back at 5, work till 8,
Gynecologists are busy.
and then go home. And this was till 2001, so I did that for a year. And then I had my son. He's 23 years old now. From the time he was born, I told myself, you know what, though I love Gynaec, I'm passionate about it,
Quite enough.
I want to be with him too. So I was very, very lucky that I started working 9 to 3, which were his school hours, and then I was at home.
Brilliant.
Of course, this was not the era where gynecologists used to do this, particularly because everybody around me felt, your practice will not grow.
Oh, I know.
Everybody wants to come home in the evening, get their husbands and come to a clinic. Nobody's going to miss work to come to you. No husband is going to stay at home and get their wives. And in my mind, I was like, it's okay. Even if I don't have a very great, busy practice, I'm very satisfied with what I do.
But it's more of a mindset, no,
It
Sejal,
is.
you had.
It is.
And also, to be honest, it's more of affordability also.
Yes, it is. So I was privileged, undoubtedly, that I could do that. Okay, but I did.
Yes,
And with
and-
time,
and
I've
you
seen that
think
my
it's-
passion for gynae grew. Passion
were
for
all the
doing
time to
other
develop,
things
yeah.
grew.
Yeah,
And
absolutely.
I think it has, given me a lot of happiness in life, which is something nobody talks about.
Absolutely.
Right? It's
I
made me
agree
really
with you.
happy. Yeah.
Talking about having children and stuff, you
Yes.
got 2 children?
Yes, I do.
Okay, and anybody becoming a gynecologist?
No,
Taking
none
over
of them.
your-
Not
Why?
even doing medicine.
Why is that? Why is
So
that?
I find it
You
so
got
strange.
inspired from your mama.
Yes.
Your kids now got inspired from her mama, his mama.
Right. So I always thought that, because of the kind of work we do with limited hours and still leading a comfortable life, the kids would definitely be drawn to it. They both used to top biology. And I thought, okay, this is the path ultimately.
Absolutely.
They both said we are not interested in medicine at all.
what are they
It
doing?
was heartbreaking.
You are heartbreaking.
Yeah.
So my both kids are doctors and it was heartbreaking for you. I actually was trying to tell them not
to do it. Yeah.
But now
Yeah.
they're both happy and I'm happy, to be
Yes,
honest, because
yes.
I think one thing that is very important for us as doctors is that
Yes.
not only we take pride in what we do,
Yes.
but I think you go back home and you think, yes, we made a change.
Yes.
And you are making more of a change than I am because you're making
you
the
are
life.
doing that too. So
No,
yes, I know that.
improving things that are, behind the curtain for many years, I think.
Yes. So my son is doing his master's in international business. Daughter's
nice.
finished her 12th and she wants to pursue biomedical engineering in the US. So I think I'm soon going to be an empty nester.
But then you'll be traveling.
Yes.
So now I
am
think-
traveling.
This abroad and stuff. I think geographical space has become now
Reduced.
limited. You know, it's just
Yes.
like 9 hours to somewhere,
Yes, it's
8
easy.
hours. It takes you 2 hours to. Other day I was going to Lonavala, it took me 4 hours. So it's no, it's
Yes,
not. It's
exactly.
not. Any sort of last message you want to give to young women? Because there's a lot of issues about infertility, PCOS.
Yes.
People not wanting to have kids. We
Yes.
discussed that.
Yes.
So any sort of message, what are your views, any message to young mothers, young children? and
Actually,
stuff?
there's one thing I'd like to tell everyone, and especially probably women, that be yourself. I don't think you have to fit into any mold. You know, if you don't want to get married, it's okay. If you don't want to have children, it's okay. If you want to have dogs and cats as pets, it's okay. It's okay if you want to have a family of 4. I think the idea is to be yourself
Be
and to be
happy.
honest with that.
Be
and
happy.
happiness. I think that's the
From
key.
3 Idiots, be happy.
Yeah, keep saying all is well, all is well.
well.
Totally. I think that's the message I would want to put
For the
across.
young gynecologists, if you want to take up aesthetics as surgery and stuff, any message? I mean, what would you sort of...
I have a
train-
word for the young
Yeah.
gynecologists. I think every time after 25 years of practicing obstetrics, you know, a patient calls me at night saying, I'm in labor. I curse myself as to why am I doing this for so many years? Every time the baby is in my hand, I know why I'm doing this.
100%.
But aesthetic and functional gynae has given me that kind of a satisfaction. Coming from an era where a very complicated surgery was required for incontinence to an era where I can tell the patient sit on the chair or walk in, walk out, and 80% of your incontinence episodes will be stopped. My satisfaction level is here. So it's a great subspecialty to take up.
Absolutely, and I think this is wonderful, and I think you've done a great job. I just congratulate you.
Thank you, and thank you for having me here.
It
It's
was fun
actually
talking to
privilege.
you. It was highly knowledgeable. I'm sure these the guys who are watching this have learned such a lot about vaginal
and
aesthetic,
functional gynae.
but also
Yeah.
about you, and
Thank
also
you.
about doctors who doing such great job. I think it was wonderful having you, Sejal.
Thank you so much,
Great
really.
pleasure.
Absolutely a pleasure being here. Thank you so much for
So
inviting
if
me.
you like this episode, please like, forward, and subscribe. Thank you, Matt, for doing this 4th episode with us.